I've followed Hobbs for a long time and support what they're doing, and a number of our patients have been going to Hobbs from our unit. It's getting the NHS and the interaction it's not easy, and I think a lot of people are feeling that there's a gap in, when people finish their rehab, and it'd be ideal to have this sort of facility for everybody. At the moment that's not possible, but it's just looking at how we can work with our commissioners and with the NHS Wales or NHS England to see how we can best manage that. It's a bit of a culture shift. I think the way the NHS delivers their rehab has got to change in the next 10 years or within the next 10 years. And, we've got to start looking at what the alternative options are going to be. I think there's probably more public interest in it, and I think it's also raising the profile of rehabilitation and what it does. And, one of the big things here was about user involvement, and I think the patient story is really powerful, so I think we've got to tap into that a little bit more. If you look at a longer-term, cost-effective nature of what they're doing and what we're doing, I think it's really important. So I'll be treating a patient for maybe up to 8 months. If he doesn't get, or she doesn't get any treatment once they are discharged, we've probably lost about 4 months of care. And that person may cost the NHS more because they deteriorate in their condition. So it is common sense to just provide that ongoing, and then it should be cost effective. But I think that's a message that we've got to work hard at in convincing commissioners. For me, it's like Welsh Government need to be on board with it, and then they would probably drive the commissioning decisions. Although we could work with commissioners to then take that back to Welsh Government. And I think, post-pandemic, we've not been having face-to-face conferences. And this is a sort of a newish organisation and newish conference. And the people are interested to know what's going on, so it's been a really good day. And, the networking is always good, and it was nice that they gave a lot of time towards that. And I think within the conference, everybody's wanting the same end, and there's lots of people who can influence different things. So, yeah, I'd like to be optimistic about where we might go in the next couple of years.